The impact of chronic illness on mental health is profound and multifaceted, affecting individuals emotionally, psychologically, and socially. Chronic illnesses, such as diabetes, heart disease, autoimmune disorders, and neurological conditions, can have significant implications for mental well-being, leading to increased stress, anxiety, depression, and social isolation. Here's a detailed exploration of the impact of chronic illness on mental health. Emotional impact. Stress and anxiety. Living with a chronic illness often leads to heightened levels of stress and anxiety. Uncertainty about the future, fear of disease progression, and concerns about managing symptoms and treatment can contribute to chronic stress. Coping with the demands of ongoing medical care and lifestyle changes can also exacerbate feelings of anxiety. Depression. Chronic illness is a significant risk factor for depression. Individuals may experience persistent feelings of sadness, hopelessness, and loss of interest in activities they once enjoyed. The challenges of living with a chronic condition, including physical limitations, pain, and social isolation, can exacerbate depressive symptoms. Grief and loss. Individuals with chronic illness may experience grief and loss related to changes in their health, lifestyle, and identity. Adjusting to the limitations imposed by the illness, coping with functional decline, and mourning the loss of previous abilities and roles can be emotionally challenging and contribute to feelings of grief and loss. Psychological impact. Self-identity and self-esteem. Chronic illness can affect self-identity and self-esteem. Individuals may struggle with changes in their abilities, appearance, and roles. Adjusting to a new sense of self and coping with feelings of inadequacy or worthlessness can impact psychological well-being and self-esteem. Cognitive functioning. Some chronic illnesses, particularly those affecting the central nervous system, can impact cognitive functioning. Individuals may experience difficulties with memory, concentration, and decision-making. Cognitive impairment can exacerbate feelings of frustration, anxiety, and self-doubt. Coping mechanisms. Individuals with chronic illness may develop adaptive or maladaptive coping mechanisms to deal with the challenges they face. While some coping strategies, such as seeking social support or engaging in problem-solving, can be helpful, others, such as avoidance or substance use, may exacerbate mental health symptoms. Social impact. Social isolation. Chronic illness can lead to social isolation and withdrawal. Individuals may struggle to participate in social activities, maintain relationships, or access community support due to physical limitations, stigma, or lack of understanding from others. Relationship strain. Managing a chronic illness can strain interpersonal relationships. Communication breakdowns, role changes, and emotional strain can contribute to conflict and tension within relationships, impacting both the individual with the illness and their loved ones. Financial stress. The financial burden of managing a chronic illness can create significant stress and strain. Medical expenses, medications, and lost income due to disability or reduced productivity can contribute to financial stress, impacting mental well-being. Coping strategies. Seeking support. Engaging with support networks, including friends, family, support groups, and mental health professionals, can provide validation, empathy, and practical assistance in coping with the emotional impact of chronic illness. Self-care practices. Prioritizing self-care practices such as relaxation techniques, mindfulness, physical activity, and creative outlets can help individuals manage stress, reduce anxiety, and improve overall well-being. Adherence to treatment. Adhering to medical treatment plans and attending regular appointments with healthcare providers is essential for managing physical symptoms and preventing exacerbations of the illness, which can positively impact mental health. Cognitive behavioral therapy, CBT, is a therapeutic approach that can help individuals with chronic illness identify and challenge negative thought patterns, develop coping skills, and cultivate resilience in the face of adversity. Medication management. For individuals experiencing significant mental health symptoms such as depression or anxiety, medication management under the guidance of a psychiatrist or primary care provider may be beneficial in alleviating symptoms and improving quality of life. Advocacy and empowerment. Self-advocacy. Empowering individuals with chronic illness to advocate for their needs, rights, and preferences within healthcare settings and society at large can foster a sense of agency, autonomy, and empowerment. Community engagement, participating in advocacy efforts, raising awareness about chronic illness, and contributing to peer support networks can help individuals connect with others facing similar challenges and affect positive change in their communities. Holistic approach, integrated care, adopting a holistic approach to healthcare that addresses the physical, emotional, and social aspects of chronic illness can optimize outcomes and improve overall quality of life for individuals living with these conditions. Collaborative care, encouraging collaboration between healthcare providers, mental health professionals, social workers, and community organizations can ensure comprehensive support and coordination of care for individuals with chronic illness. By recognizing and addressing the impact of chronic illness on mental health through comprehensive assessment, intervention, and support, individuals can better cope with the challenges they face and enhance their overall well-being and quality of life. Don't forget to like, share, and subscribe to our channel for more valuable information on health-related topics.